Hi, Dr. Packer here with Precision Spinal Care. Today we're going to talk about arthritis, something very commonly known to many of my patients over the years, and maybe you know well about it yourself. Let's first define the term. Arthro just refers to a joint. It could be a joint in the body, usually associated with the spine. Itis is simply a term that means inflammation, so it's simply inflammation of a joint. Again, typically related to the spine, and there's two major types of arthritis. Number one is OA, known as osteoarthritis. This is the more common form, and this is usually due to a structural imbalance with the spine or due to an old injury where something's just been misaligned and it creates stress or wear and tear on the joint or the vertebra. And typically what happens with osteoarthritis is the bone will start to change shape and you may get little bone spurs or ragged edges, and usually that also affects the disc in between the vertebra, where it'll start to shrink in size or lose blood flow and oxygen and even bulge or herniate, and that can even affect the nerve that exits in between the spine. That's known as osteoarthritis. Now there is another type of arthritis known as rheumatoid arthritis, or RA. That is an autoimmune disease, and it's typically when the body attacks itself, and it doesn't just affect the joints, it can even attack the organs within the body as well, and that usually just requires medical care and medication. There's not much that we do as NUCCA or chiropractic for rheumatoid arthritis. But the osteoarthritis, many people live in chronic pain and are told, here, just take these NSAIDs or take these steroids or these different medications to deal with the pain. The problem is they're never dealing with the root cause or the structural things that created the arthritis in the first place. We're going to talk real quickly about some of the side effects to the common medications used to treat arthritis. Now there's so many, I've actually had to write them down to list them out here. So the common effects of the NSAIDs and the different pain medications used are kidney damage, hemorrhage of the esophagus, stomach disorders, hemorrhaging of the stomach, the intestines, and many GI complications. Now, steroids actually can cause a thinning or weakening of the bones if they're used on an ongoing basis. And of course, some people, their joints just wear down so much that they're required to have surgery. Again, only cutting away a bone spur or cutting away or shaving part of the disc that's hitting up against the nerve, but that rarely solves the big picture problem of the structural misalignment. So what we do with NUCCA care is we focus on fixing the cause of the problem by dealing with the misalignment in the first place. So if I use an illustration here to show you, if the spine is out of alignment, we're going to work on correcting the uneven leg lengths, the imbalance in the hips, which creates a lot of the stress and strain through the spine all the way from C1 all the way down to the bottom at L5. So our goal with NUCCA care is to restore body balance, get that stress off the joints that's causing the spine to break down and to become inflamed around the nerves, around the joints, around the disc, and repair those areas. So again, not only is NUCCA or chiropractic care safe and natural, but it treats the cause of the problem rather than just trying to mask the symptoms of arthritis with long-term use of medications, which again have many side effects.